This leads us to more fractures, more ER visits, sometimes really fatal injuries such as bleeding, and also sometimes death. A lot of times death occurs not because directly of a fall, but because of the after effects. After a fracture, you get depressed, you're not mobile enough, you become bedbound. So these are the reasons why it is so important to address falls. So let's talk about why is it important to talk about falls and who is at risk. First, we need to understand who's at risk of falls. When you're weak, when you have diabetes, you have nerve damage, you have heart failure, you're on medications that can cause dizziness, that can cause change in blood pressures. There are many other causes such as being on multiple medications, overusing alcohol, having hearing loss. Then there's other issues such as loss of muscle mass, especially in women. As we get older, as is our core muscle strength is less. There's also enough data that shows postmenopausal, we become less active, and so we lose more muscle. As we lose more muscle, we don't have the strength. When we're walking, it increases our risk of falls. The first thing is to make sure that we keep our surroundings safe, whether it be in the house or outside the house. Number two, if we have vision changes or if we have hearing loss, please make sure that you have this addressed, because there can be some resistance to wearing hearing aids or to wearing glasses, but definitely please, in the long run, it does make a difference. Number three, using assistive devices. If you do know that you feel weak, always make sure you have a walker, whether it be a walker or a cane, make sure that you have it at hand. Number four, make sure your family is with you on this and that they help you be more vigilant, because a lot of times family support makes a tremendous difference. Number five, review your medications with your doctor. Make sure that you're on the right meds. If you're having increased dizziness or increased risk of falls, or you fear of falling, whether that even be as simple as stumbling, make sure you discuss with your primary care physician and review your medications to make sure that you're not on high-risk meds that can increase the risk of fall. Maybe there are medications as simple as where you take them at nighttime that causes increased dizziness or confusion. Maybe just switching the timing can make the difference. Next is also to make sure you stay active. A lot of times, elderly population, we fear that the more we walk or when we walk, we are falling or going to fall, but not staying active is actually the bigger cause of the fall. So make sure that you're as active as you can. Whether that be you do exercises at home or you get therapy on time, talk to your doctors about that, or whether that be doing aqua therapy to strengthen your muscles, or just simple walking a few times a day, even short periods of time to keep that muscle stronger, that will help. And the other reasons also to remember is medications. We give more importance to only prescription medications, but we have to remember that even over-the-counter medications, as simple as taking Benadryl for sleep or sleep aids, Tylenol PM, which actually has Benadryl in it, and we think that it's a very benign medication to take, but that also causes increased dizziness and increased risk of falls. Dementia, memory loss. And we all know that even whether it's personal or with our families, that when there is increased confusion with dementia, it causes increased risk of falls because you don't know your surroundings as well. In fact, there is enough data to show that falls are the number one and increasing cause of non-fatal and fatal injury in elderly population. Nutrition plays a major role because poor nutrition causes weakness, it causes dizziness, it causes changes in your sugars, in your blood pressure, as well as muscle wasting. So proper nutrition, making sure that you're not losing muscle mass, which is actually a part of aging, to lose muscle mass. That making sure that that does not happen. If you notice that, please talk to your doctor or see a dietitian to get more information. Falling is not a normal part of aging. Yes, it can happen, but you can prevent the falls, and with the right exercises, with the right nutrition, with the right equipment, with the right interventions.